Are there things that I should not be doing?
Definitely. Don't lift anything that weighs more than 10 pounds for at least 6 weeks. That includes suitcases, groceries, and children. After that time, you can gradually increase what you lift and carry.
Avoid pushing and reaching until your breastbone is completely healed. Don't push heavy doors, open windows that are stuck, or reach to high shelves. Find someone else to mow your lawn and to move furniture if necessary.
In fact, try not to be too disappointed, but for 6 to 8 weeks, you'll need someone else to do all your favorite household chores, like vacuuming, laundry, and taking out the garbage. Studies show that women tend to start doing household chores too soon after surgery. Remember, it's important to put your health first during your recovery. One thing you should do is quit smoking.
Smoking hardens the arteries and clogs up your bypass grafts. It's the most important thing you can do to prevent problems down the road.
Finally, don't drive for at least 3 to 4 weeks after your surgery. Remember, your reaction time is slowed due to tiredness, weakness, medications. When you do start driving, take along a friend and take easy routes. Remember to drive in good weather and light traffic, and always take familiar routes to reduce the stress.
Is a round of golf okay?
No, not in the early recovery period, but you may practice your putting. Check with your doctor before resuming any activity that involves vigorous arm and shoulder movements.
I've got a swollen ankle, and I've got a tingling feeling in my leg and my hand. What should I do?
The swelling in the leg that the vein was taken from is very common. It should go away in a few weeks' time, maybe about 12 weeks. In the interval, you can help relieve that by avoiding standing or sitting in the same position for a long time, raising your leg whenever you can, and doing your leg exercises. Some people also complain of numbness in their fourth and fifth fingers, and this too is temporary, will go away in 1 or 2 months and should not worry you.
What shall I do if I feel chest pains?
After heart surgery, patients do feel stiff and sore for a number of weeks. This discomfort is usually relieved by pain medication. However, if the pain relievers aren't working, or if you're experiencing pain similar to your angina pain or any other chest pain that you don't know what it is, call your doctor. If you can't get through, stay on the safe side and have someone bring you to the nearest hospital.
You should also call your family doctor if you have swelling in both ankles, increasing shortness of breath while lying down or walking, a weight gain of 3 pounds in 2 days, a feeling that your heart is racing, pounding, or skipping a beat, or signs of infection. These are fever, a very red, tender area on your incision that is warm to touch, and yellow-green drainage from any incision or chest tube site.
And I suppose what I would say to other people who have faced the operation is you may have odd physical problems of one sort or another, but they'll pass as your body adjusts and gets better.
What can I eat?
Patients need to eat well when convalescing. But if you had a poor appetite when in hospital, chances are you'll still have a problem for a little while when you're at home. For the first 4 to 6 weeks, you can eat just about anything. But do try and limit your salt intake and follow the Canadian guidelines for healthy eating. Your eventual goal, of course, is to follow a heart-healthy diet.
A heart-healthy diet means reducing the amount of salt and fat you consume. Eat lots of fruits, vegetables, and whole grain breads and cereals. Eat smaller portions of lean meat. Choose low-fat dairy products. Eat no more than 2 egg yolks a week. Cook with unsaturated fats, such as canola and olive oils and soft tub margarines. And limit salt. Use other seasonings to give flavor to meals. And avoid products like canned soup and processed meats, which have a high salt content. If your doctor okays alcoholic beverages, limit your intake to 1 ounce of hard liquor, 1 beer, or 4 ounces of wine per day.
If you have any additional questions, be sure to talk to your dietitian and arrange an outpatient appointment for a consultation.
I'm having trouble with constipation.
Constipation is common after surgery due to pain medication and reduced activity levels. Make sure you're eating foods high in fiber, such as fruit, and whole grain breads and cereals, and drinking the recommended 6 to 8 glasses of liquids per day. If constipation continues to be a problem after you go home, talk to your pharmacist.
I've noticed my mood seems up and down. Will this continue at home?
Mood swings and the intensity and the intense emotions such as anxiety and depression are common during recovery. The intensity of these feelings should subside at the end of the recovery period, but in the meantime, they can be very hard on everyone around you. Communication is most important, and especially at this time. Encourage open and honest discussion about feelings, both yours and that of other family members. If these feelings persist beyond the recovery period, then please consult your family physician.
Other common reactions after surgery may include changes in sleep patterns, recurring dreams, temporary memory loss, and difficulty concentrating. These may be troublesome, but they are temporary. Education, information, and support groups may help patients and families cope during this time. If any of these options appeal to you, ask your family doctor for guidance. Families naturally want to protect their loved ones and do things for them, but it's an important part of patients' recoveries to do as much as they can themselves.
When is it safe to have sex again?
There are really no rules. Sex is a form of exercise, and therefore it increases your heart rate and increases your blood pressure. But if you feel that you can climb 2 flights of stairs without too much difficulty, that would be an appropriate time that your body's telling you you could have sex. You obviously have to make certain that you're comfortable. The main concern from a cardiac point of view post-operatively is that you do have a sternal incision and you do have an incision in your leg, so you want to make sure those are protected and comfortable, and therefore the sideline position is probably the most appropriate. But it's whatever is best for you and what you're comfortable with.
Take your time, be comfortable, relax, and enjoy. But use your common sense. If you're having sex and start to feel tired or develop chest pain, stop and rest. Doctors also recommend that during recovery, you should not have sex when you're tired or upset. If you've just had more than 1 or 2 alcoholic drinks, for 2 hours after a large meal, or with an unfamiliar partner.
Many people find that their sex drive is decreased after surgery, and this is probably due to fear or discomfort, or possibly due to the medications. If you have any concerns at all, you should talk to a member of the healthcare team. They can be very helpful.
Is it safe for me to travel?
Well, if you're thinking of traveling for pleasure, check with your family doctor first. But for some people, just getting home from the hospital may mean a long trip. If home is a long car ride away, you may be more comfortable lying down in the back seat. Ask the person picking you up from the hospital to bring along a pillow and a blanket if it's a cold day. Above all, make sure that you get out of the car and stretch your legs once an hour. If you'll be flying home, you're going to need extra help, so contact the healthcare team.
What about going back to work?
How soon you return to work depends on your condition and the type of work you do. If your work isn't physically demanding, you may be able to start back on a part-time basis in a month or 2. If your work is more physical, wait at least 12 weeks.
When do I see my doctor again?
When you get home, you will need to make the following appointments. With your family doctor within a week of discharge. With your cardiologist 4 to 6 weeks after discharge. With your surgeon, call their office for an appointment.
When you have your appointment with your cardiologist, you should ask what kind of cardiac rehab programs are available. These cardiac rehab programs offer a variety of services, such as exercise guidelines and nutritional and pharmaceutical counseling. Most people feel they benefit from these programs due to the companionship with other patients, also due to the constant being in constant contact with healthcare professionals, and they begin to feel more confident about their bodies again.
Learning about their cardiac rehab program was very positive because I wanted a structured, monitored way to get myself back on the right path, and that was one way to do it.
The one thing that I found about the rehab group was actually being with people who had been through the same thing. It's a wonderful camaraderie group, but not only from an exercise group, physical, but mentally, socially, and emotionally.
because they were able to give me a level of exercise that suited me perfectly, and to give me advice when I ran into aches and pains, problems with joints and that kind of thing.
Cardiac rehab starts during your hospitalization. While others may prefer to exercise on their own, a cardiac rehab program provides you with the necessary guidelines to enable you to exercise safely on your own, increasing your activity level as you are able. Ultimately, we all have to take responsibility for our own health.
And you can live a long and happy and productive and active life, but you really must modify your lifestyle. First of all, you must not smoke. And you should eat sensibly. Obviously, a low-fat diet is preferred. And you should exercise regularly.
And if you keep on thinking positive, and that is so important, don't give up. You have to keep saying to yourself, I'm going to make it.
That this operation isn't a cure. He said all it does is take away the pain. But he says the thing is, it gives you the opportunity to cure yourself.
And in fact, I had the surgery at about the middle of October, and I was skiing in January.
It's one of the best things that ever happened to me in my life because it really changed my life. Now I play hockey 3 days a week. I've lost close to 50 pounds, so it's a whole new world for me. I'm in better shape today than I was 30 years ago.
We hope this presentation has answered your questions. If you're still unclear about anything, please ask a member of your healthcare team.